Welcome, friends, to another episode of CNS Viewpoint. Today, just like every day, at 5 p.m. India time, we are sharing our thoughts and perspectives and viewpoints on some issue which made us think, recently. So today we are going to talk about on 9th of September 2021. There were news in several media that only 8% of population of Uttar Pradesh state in India is fully vaccinated. 8% so far. So it's almost like 8-9 months since we began vaccination on 16 January 2021, and so far we should have crossed 70%, but right now we are only at 8%. The only ray of hope in this grim scenario is that the pace of vaccination, if you look at how many vaccinations are done in is a bit is rising, but not rising fast enough. According to health officials, this was very worrying that number of fully vaccinated is less, primarily because of unavailability of vaccines. This is so very alarming. Unavailability of vaccines. We really wish we had stronger health systems where supplies were regular, and people the pace of vaccine was not holding back just because of unavailability of vaccines. In Uttar Pradesh, out of almost 150 million people who are eligible for the vaccine, or about 80 million have got more than 80 million have got the first dose, and about 13.2 million have got 13.2 billion have got the second dose. So about 8% have got the second dose and are fully vaccinated. Nationwide, over 1 crore, which is 10 million vaccinations, have been done 3 times in 24 hours, 3 times as of 9th September 2021. And this is important to remember, because government had promised that it will be doing 10 million vaccinations every day since months, so that we are able to vaccinate all the eligible people by end of this year. So we are way behind. There are only 3 days when we have been able to meet this target, and it's almost like 8-9 months since we began the vaccination. Because it is also important to remember that while we celebrate these days when we had achieved vaccination target of 10 million people, so these are only 3 days. But what about rest of the days? The number of vaccinations done in 24 hours was very, very low, was very alarmingly low. It was almost like, for example, the last 10 million vaccinations done in 24 hours before 9 September 2021, a day or two before, we only vaccinated 25 lakhs or 2.5 million. So on one day we have 2.5 million. After a day or two, we reached the target of 10 million, and again the numbers drop. So I think this kind of we need to get out of the celebratory mode and get into the mission mode, where we are really able to maintain these targets every day, because it is so vital to ensure that we vaccinate all the eligible people. It is not about just meeting a target, but it is more about ensuring that we are able to vaccinate every eligible person on the planet Earth, not just in Lucknow, Uttar Pradesh, or India or Asia, but the whole world. Because that is the only way we can, and that too we have to vaccinate within a stipulated time frame. It's not like we have endless time. We are running behind time. We are running way behind time. Ideally, all the eligible people in India should have received the vaccination, so that we have the best of shot in making COVID history. And not just India, because no one can end COVID. No country can end COVID just by vaccinating its own people. We don't live in a bubble. So, we have to ensure the same high level of vaccination protection to every person on the planet Earth. Every human being who is eligible to get these vaccine shots, we should have had it in a very limited short period of time, and time is running out, friends. Let us hope the pace of vaccination picks up everywhere, globally, worldwide. The rich countries are talking about going for third booster dose of vaccines, or third or whatever booster dose of vaccine. And then there are countries in African continent, or in Asia Pacific region, Latin American countries, where the level of vaccination, fully vaccinated people in their nations, is way shorter than countries which have been able to vaccinate a significantly large number of people in their nations. So, for instance, Singapore has over 80% of its population fully vaccinated. Countries like Uruguay, like Chile, have over 70% of their people vaccinated. Several nations like US, Canada, several European nations, and other some rich Asian nations have very high level of vaccination. Over 50%, more than half of the populations was already vaccinated at least a month back. Of course, by now the vaccination rates would have risen. They are doing great. Of course, it is important, and we really wish that every country is able to meet those kind of standards and high level of vaccination protection for all those who are eligible, because that is the only way we can make COVID history. This is not the time to have individual scores, but it is a time to stand together, stand united, and help each other, and especially help those who need more assistance in terms of weaker health systems, weaker supply chain or access and delivery systems which should have been in place and which aren't there in those places, etc. The issue like unavailability of vaccine, if it is holding back Uttar Pradesh from accelerating the pace of vaccine even further, has to be addressed. It's high time it gets addressed at a top priority level. Any other obstacle which is coming which is slowing down the pace of vaccination in states like Uttar Pradesh should really must get topmost priority from the government and get addressed, because the only thing matters right now as far as COVID prevention goes is ensuring that vaccines reach every eligible person on the planet, not just in one state or two states or one country or two countries, but all over the world. That's the only way our human race can think of making of having the best shot. That let's hope the vaccination works in making COVID history. So friends, whether you have received your dose or not, let's hope you do soon, but make sure that you are wearing mask, wear mask properly, maintain social distancing, observe all COVID protocols so that you can break the chain of transmission of the virus, and that is our little contribution. Remember, vaccines are proven and shown high level of protection from serious outcomes of COVID if coronavirus infection happens to that fully vaccinated person. But the data is not very conclusive. We don't know yet, although it is likely, but we don't know yet how the role of vaccines in preventing transmission, in protecting against contracting the infection. So please observe all COVID prevention protocols, even if you are fully vaccinated. I'll be back again, connecting with you all, sharing some of our thoughts tomorrow again at 5 p.m. India time. Till then, all the best, stay tuned, and stay safe. Bye bye.